Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Heart disease is responsible for 1 in 5 female deaths each year, and about 1 in 16 women aged 20 and older have coronary artery disease, the most common type of heart disease in the United States. On today's show, we will learn more about the cause of heart disease in women, treatment options, and prevention methods. We are pleased to welcome Dr. Rachana Kulkarni, a board-certified cardiologist with Medicor, an affiliated medical practice of RWJBarnabas Health, and is on staff at Robert Wood Johnson University Hospital, Somerset. Dr. Kulkarni is currently the Director of Community Cardiology and Preventive Health for RWJBarnabas Health's Southern Region and a physician leader with the RWJBarnabas Health Women's Heart Health Collaborative. Welcome to the show. Thank you, Dr. Kulkarni, for being here. First of all, for the studio audience and for everyone watching, can you just give us a little bit of background on yourself, where you went to medical school, and where you currently are practicing?
Of course. Thank you, Doug. Thank you for having me. My name is Rachana Kulkarni, and I practice in Bridgewater, New Jersey, and Hillsborough, New Jersey. And with Medicor cardiology that I have been practicing with for the last 27 years. I am a Rutgers Robert Wood Johnson through and through, did my residency there, my cardiology fellowship there, and have been practicing there for the last 27 years.
Thank you. And again, you are a leading person on cardiology, especially women's cardiology, which when I went to medical school, women and men were basically, we were taught it was the same thing no matter what. Women and men had the same diseases, women and men had the same symptoms, women and men, it's the same thing. But since then, we've learned that there's been a lot of changes and that women are different than men are. And any husband can tell you from their wife, they're certainly different than they are. But can you tell us a little bit about heart disease, what it is, examples of heart disease, and other ways that we can manage it prior to my sending them to you to be seen?
Certainly. Heart disease, if we look at its entire spectrum of cardiology, so there are different aspects. If we categorize them broadly, heart disease has coronary artery disease, which is what we typically associate heart disease with, which is blockages in the 3 heart arteries that supply the heart itself. And the problem with that can cause heart attacks. I like to make things simple and put it in a context of a house. So if I put the heart in a context of a house, it has basic architecture, which is 4 rooms, so 4 chambers of the heart, 4 windows, 4 doors, and the 4 valves. So problems with that, leaking in the valves, can cause congestive heart failure and valvular heart problems, which can need valve replacements in extreme cases, but most of them can be managed medically. So problem with the heart's musculature can cause weakness of the heart muscle, leading to congestive heart failure, and which is typically known as cardiomyopathy. And the third thing is heart's own electrical system. Problems with that can cause irregular heart rhythm, which we call as arrhythmias. Atrial fibrillation is the most common cause of arrhythmias, but then there can be skipping of beats, which we call as atrial or ventricular premature contraction, paroxysmal supraventricular tachycardia, when some of the heart circuitry goes into short circuit. and causes irregular heart rhythm, which can lead to passing out and other things. So the three broad categories are problem with the structure of the heart, problem with the electrical system of the heart, and problem with the plumbing system of the heart, which can cause heart attacks. For most discussions, we focus mainly on heart coronary artery disease, which is problems with the blood supply to the heart itself, because that can be a genesis for the two other problems as well.
So again, the heart being one of the most important muscles in our body, innervated by the arteries and veins. And what we talk about is the three main arteries that supply oxygen to the heart. The left main, the right coronary artery, the left anterior descending. All important.
And the left circumflex.
And yes, and of course, as everyone knows, the left main, that's the widowmaker's one. That's the one when, God forbid, something happens there, you really have very little opportunity. You have to get the person immediately to the hospital so that something can be done immediately. And there are so many things that we can do prior to that. What are the things that we can do to prevent coronary artery disease, prevent the problems in the heart?
Excellent question, because there is so much that can be done to prevent us from having those blockages. I think as a health system, we are now shifting our focus from heart disease to heart health, which is where we would love people to take more stock in their health. And how do we do that? Important thing is visiting your primary care physician on a very regular basis is instrumental in health, because the three things that can cause heart attack or heart disease is high blood pressure, diabetes, and high cholesterol. And these three are silent killers because they don't give us any symptoms. So it's very important to know our numbers. And how do we know our numbers? We go to our primary care physician. We make sure our blood pressure is measured. Ideal numbers are below 120/70. Our blood sugars are under good control, because risk of heart disease in diabetic people is 3 to 5 times higher than as compared to non-diabetics. And again, these things don't give us any symptoms. It's extremely important to know our cholesterol numbers, because one of the biggest contributors to heart disease is elevated cholesterol. And that's the reason they're called silent killers, because diabetes, hypertension, high cholesterol do not give us any symptoms. So knowing our numbers, knowledge is power. Knowing our numbers can go a long way in preventing heart disease.
So again, important things. Following up with your primary care doctor, whether it's your OBGYN, your internist, your family practice person, starting somewhere around age 20, going periodically, checking blood pressures, checking your BMI, your body mass index, trying to get that under 25 in order to reduce the risk of problems. Knowing what your cholesterol number is, knowing what the total is, knowing what your HDL is, knowing what your LDL is, knowing what your triglycerides are, and trying to do any type of health interventions to improve them. Doing the blood work to know whether or not you're a diabetic or not. I had someone this past week who at 28 had no idea that she was a diabetic, and found out on blood work she had no symptoms, and found out on blood work she was, and we're able to now over the next year reduce those numbers, and thus reduce her risk of problems down the road. It's also going through family history. If you have a family history of people having coronary artery disease early on in life, that increases your risk. So again, adjusting risk factors. Gout increases the risk of heart disease. So there are many modifiable things that we can do. And then of course, cigarette smoking. So if you're a cigarette smoker, get off the cigarettes. And if you can't get off of the cigarettes, RWJBarnabas Health has a great smoke enders program that works terrifically to help you get off of that. If you have any type of overweight, the BMI being elevated, speaking to your primary care doctor, getting into a dietitian, and or even if it really is bad, the use of medications to help reduce the BMI and thus reduce coronary artery disease, reduce the risk of developing diabetes. disease. So there are many things that we can do to help reduce coronary artery disease. Now, let's go to women versus men. Are there differences in heart disease, and are there differences in symptoms between the two?
There is huge difference. Women are not little men, and studies have shown us over many decades now that heart disease presents very differently in women. Typically, we associate heart disease with chest pain. That's what is taught to us at an individual level, at a community level, at a societal level, and even in med school. We were taught heart disease is typically chest discomfort, pressure, crushing sensation in the chest radiating down to our left arm. However, now we know that heart disease presents very differently in women. Some women will have the same symptoms. However, a lot of times those symptoms are subtle. Instead of chest pain, a lot of times shortness of breath is the presenting symptom in women. Also, sometimes intense fatigue, pain in between shoulders, feeling of nausea can be the presenting symptoms. And because of that, there is delay in presentation because the woman herself sometimes fails to recognize that these can be heart disease symptoms. At a family level, family fails to recognize that these can be symptoms. That's why, on an average, there is a 6-hour delay in a woman presenting to the ER. There is delay in healthcare for women in the realm of heart disease at every level. There is delay in getting electrocardiogram. Because of delay in presentation, there is delay in providing the appropriate treatment, which leads to worse prognosis. So my appeal to all our viewers is know your risk factors, but also pay attention to your body. If you're feeling short of breath, and if you're a woman, you're feeling short of breath on exertion, if you're feeling unexplained, intense fatigue, don't ignore this and seek intervention, seek help. Women, as a result of this delay in diagnosis, we have adverse prognosis across the board. In heart disease history and in heart disease treatment, more women die of out-of-hospital cardiac arrest because they don't seek care and help in time. So, an unfortunate fact is the only thing women do better than men in heart disease is they die. More women die of heart disease because in out-of-hospital cardiac arrest. And it's a sad fact. It can be avoided if we start paying more attention to women's heart health.
So as a leader of the Women's Heart Health Program at RWJBarnabas Health, tell us about your vision. Tell us about what we're going to be doing now, what we're going to be doing differently, and what your vision is of the program.
We would love to have a program for women and a physical center for women where we take care of women's heart health throughout the spectrum of their life, identifying their risk factors at early age so that we don't have to deal with the outcomes or the complications of untreated risk factors in the future. So identifying their heart health. A woman's body changes significantly after childbirth and menopause. And let me take a moment on elaborating on that. We are noticing that more and more women are having complications and heart-related complications in their pregnancy and immediate postpartum period. That poses that particular woman for more risk of heart disease later in life. We want to identify, treat them, and take care of them, and not abandon them after the third trimester. We should be there for continuum. So postpartum and peripartum heart health for women, I would love to be there. We would love to be there in continuum. Also, every postmenopausal woman should get screened for heart disease because risk of a woman dying of heart disease is 1 in 3. Let me take a moment here that a lifetime risk for a woman of having heart disease is 1 in 3. Lifetime risk of a woman having breast cancer is 1 in 38. Number of women dying for heart disease is 400,000 per year. Number of women dying from breast cancer is 40,000 per year. Still, there is so much emphasis on breast cancer, and more power to advocacy, more power of prevention. We want to create similar level of awareness, advocacy, and heart disease prevention for women. And that's my overarching goal for heart disease in women, this heart center.
What a wonderful thing that you're doing. It's not anything that we had learned in medical school. It's not what many cardiology groups around the state or the country are thinking about. You're thinking about something very innovative, something that really will help improve women's heart health. Mm-hmm. And I really, it's wonderful what you're describing and what you're talking about. What types of heart conditions do you envision the Women's Health Program treating?
The Women's Heart Program will be treating cardio-obstetrics. That means taking care of hypertension during, after pregnancy, mm-hmm. which is getting very, very prevalent now. Second thing mm-hmm. is Takotsubo's cardiomyopathy is another thing. Women's heart responds very differently to intense stress and can present as a heart attack. It gets ignored. This can lead to congestive heart failure. Second, another thing is microvascular angina. When we look at coronary artery disease, there is a different distinct pattern of angina and vascular disease in men and women. Men can have macrovascular, that means distinct blockages in the 3 main coronary artery disease. Coronary arteries, the left anterdescending, the left circumflex, and the right coronary artery. However, studies have shown now that women's anginal pattern is different. They have more blockages in the microvasculature in the coronaries. And for that, stenting and bypass is really not an option. It's lifestyle modification, it's identification of that, and then treating it appropriately with appropriate medications. And a Women's Heart Center will focus on that. Also now, we have seen that the cardio-oncology program is growing as well, as the survivorship in oncology, especially in breast cancer, is on a rise. We would like to have a center where breast cancer and other cancer survivors will have a place to take care of their heart health.
Again, lots of great innovative thinking on your part. And, probably something that very few other cardiology groups in this area or in the state are even considering at this point. The nice thing is you do have the backing of RWJBarnabas, since they recently put in the cardiac CT PET scanner, which will help in looking at this type of stuff also.
Let me add this, that with that PET scanner, we will be able to diagnose microvascular angina and vasospasm, which are two prevalent types of vascular issues in women.
Again, something so innovative, something so up to date, which, again, when I send people to other cardiologists, I don't hear them talking about that. We had talked about Prince-Meal's angina years ago and the use of calcium channel blockers, and we never really could see anything that we just said, well, maybe it's it. And then sometimes when that didn't work, the person would say, well, then the woman, there's something, it's in her head. She doesn't have cardiac disease, which really is not the answer. The answer is you go the next step and you look for the etiology of what it's actually doing, and then you can actually treat the disease.
Now we actually have the cardiac PET where we can identify microvascular angina. And in the cath lab now we have flow wires that we can see whether this is vasospasm, whether this is microvascular disease, and can treat the women appropriately instead of telling them this is just anxiety.
So innovative. I've got to tip my hat to everything that you're saying here. Now, as a cardiologist, also, do you push cardiac rehab in the women?
Absolutely. One of the risk factors for both men and women, and especially in women, is physical inactivity. American Heart Association recommends minimum 30 minutes of physical activities 5 days a week. And we know as a nation, we are getting more and more overweight. For heart disease prevention, physical activity is extremely important. And if you have a cardiac event, regaining your preconditioned physical activity and actually getting better is so important. Cardiac rehab is underutilized risk factor modification modality that is covered by most insurances and is underutilized. I find that very important for heart disease, also in congestive heart failure, to increase functional capacity. So I highly encourage all my patients to take advantage of cardiac rehab. And we have great cardiac rehab facilities, both in Hillsborough and in New Brunswick and many other areas that I think we all should utilize.
So again, underutilization of the rehab, which again, we want to get the person back to their state prior to the event.
And hopefully better.
Or even better. And what we want to do is we want to reduce the risk factors as well as recondition them so that they're not sitting on their tuchuses all day and getting fat and increasing their BMIs.
Exactly. So if I will always tell patients that we do these interventions, both lifestyle and pharmacological and procedural intervention, so your heart is better than before you came to us. And cardiac rehab is an integral part of that intervention.
So again, we do both preventative prior to the event and cardiac rehab after the event. We tell the people that, again, since everyone has an iPhone now, we tell them that they should be doing a minimum of 7,000 to 10,000 steps a day. And since they've got the eye health on their iPhone, they can really look at it every day to see what they're doing. We tell them that they've got to do weight-bearing exercises, and especially, again, the postmenopausal woman, we want to do that not only to reduce cardiac risk, but also to reduce their osteoporosis risk. We tell them that strengthening exercise is very important. We also tell them that the core exercises, which everyone hates to do, are very important because, again, that helps reduce the cholesterol, that helps reduce the hemoglobin A1C and the glucose. And as I said, every time I see a patient for an annual wellness and I go through it and I say, all you need is 10 minutes a day of basic core exercises such as push-ups, sit-ups, planks, plank jacks, hollow holds, swimmies, bicycle crunches. If you do 10 minutes of that every day, your midsection will start to tone up. You'll reduce your weight, you'll reduce your BMI, you'll reduce your cardiac risks. You know, it's if we can do more on the prevention, it hopefully means less of the cardiac rehab afterwards.
Yeah, our goal should be, heart disease prevention. Most of heart disease is preventable by identifying and addressing risk factors. And it's a partnership that you develop with your patients and, with your primary care physician. Get to them, invest in your heart health. Most heart disease you can prevent, so we don't have to deal with complications such as coronary artery disease and even more congestive heart failure. So we can all live our golden and platinum years healthy.
Okay, as we're getting close to concluding our show, what key messages do you want to leave our audience about cardiovascular diseases and the services at RWJBarnabas Health?
Heart disease starts early, so it's never too early to know your numbers, visiting your primary care physician, and invest in your heart health. If you know your family history, invest in addressing diabetes, hypertension, high cholesterol. If you have heart disease, identify your problems, seek help, and we now at RWJBarnabas Health, we have modalities to diagnose coronary artery disease, also macrovascular, as well as microvascular angina. We have modalities to identify heart disease specifically in women, and we will be having a heart center that will take care of heart health for women throughout the spectrum of their life. So take care of your health.
The other thing, of course, we have to remember is if you're a smoker, please give up the cigarette smoking. And if you can't do it by yourself, use your primary care doctor and/or contacting RWJBarnabas Health and look at the Smoke Enders program to hopefully get yourself off of it. So again, important the fact that the leadership of RWJBarnabas Health sees the fact that there are things that we can do to help prevent heart disease, has the terrific cardiologists on board working towards it, have the innovative thoughts on it, and hopefully will down the road be able to reduce the risk of coronary artery disease so that we won't have to have programs like this in the future.
This is our vision, and I am so thankful to the leadership for supporting the vision of creating a heart center for women.
Thank you, Dr. Kilcarney, for being here, and thank you for everything that you do for our patients.
Thank you. Thank you for giving me this opportunity.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about RWJBarnabas Health's cardiovascular service, visit us at www.rwjbh.org/heart.